Welcome back to The Price of Business. I'm your host, Kevin Price, talking to you about you and your business. Dr. Geetinder Goyal, he's a regular on The Price of Business. He's involved in a healthcare revolution that I personally am very excited about. The idea of people beginning to own their healthcare and really having a relationship with their doctor restored, a relationship that I think has been really distorted thanks to government and insurance. And really delighted about the work he's doing and love the interviews that we have. And Dr. Goyal has a very unique practice. I'd like him to talk a little bit about his work and his practice and then introduce us to our guests. By the way, his website is ourwayhealth.com.
Good morning, everyone. Thank you, Kevin. Glad to be back again. Our Way Health is a foundation, basically, where healthcare providers and our members, our patients, we have come together and completely changed how we buy and sell healthcare. And my guests today are Bruno and Randy Sluder. And these, I learned about Randy and Ron recently when I had the pleasure of meeting them here in Houston, and they represent Altrua HealthShare, which is also a part of a growing movement, which is cost sharing, health sharing, for the common good of everybody who is part of the health sharing ministry. Welcome, Ron, and welcome, Randy.
Dr. Goyal, thank you so much for your time. And Kevin, thank you so much for giving us the opportunity to be on and talk a little bit about, as you said, this amazing movement in the healthcare sharing industry, and the differences between what it is that our members participate in compared to the insurance world, and also the differences in the different healthcare sharing ministries, because there are some, I guess the best way to look at there's quite a few differences, and there's some misunderstanding about what it is that we do within the HCSM or healthcare sharing ministry system. And so that's obviously this is what we're here to do and talk a little bit more about it. And as you said, just talk about if people want lower health care, you got to take care and you move forward with taking care of your own health, and that's what we're about, and it's education and assisting our members.
Great. And let me be careful. Help us make sure we get people not falling all over each other. I should have said this at the very beginning, so I apologize. So, Dr. Goyal, let's make sure we ask specific people questions so that they're not waiting to figure out which one should answer and that type of thing. And something that would help me is Ron and Randall, real quickly introduce yourself and particularly your roles real quickly in the company. Ron?
Yeah, this is Ron Bruno, and I am the Vice President of Business Development for Altrua HealthShare and at Crown Administrators, which is the administrative portion of Altrua HealthShare.
Very good. Randall?
Yes, sir. I am the Executive Director for Altrua HealthShare, and I'm the founder and CEO for Crown HealthShare Administrators.
Very good. And Dr. Goyal, your question.
First question is to Ron. Ron, you just briefly mentioned that how Altrua HealthShare does have some nuances and differences from other, I guess, maybe more commonly known healthcare ministries like Samaritan Ministries, Medishare, and Christian HealthShare. So tell us very briefly about Altrua HealthShare, what makes it different from other ministries.
Yes, sir. And the difference between us and the others is that based off of our recognition, we operate off of a statement of standards and not a statement of faith or maybe a statement of ethics. So we are not tied to one specific religious background or religious belief. We're opened up to all walks of faith. And so regardless of what that your faith is, and even non-believers, as long as they adhere to that statement of standards, which are biblically based, but we tell everybody you throw out the biblical side of it, it's just a healthy way of living. The other portion that separates us from those other healthcare sharing ministries is we operate off of a member's escrow account. So contributions, or as people in the insurance world know it as premiums, those are monthly per member or per family, are contributed into an escrow account, and then as needs are met or required claims, if you will, those are reimbursed to the provider or paid to the provider through the utilization of the member's escrow account. So it's not the sharing letter or the share boxes that go on with the typical healthcare sharing ministries, or where the member is not responsible up front for the specific medical need or claim, and then they have to wait for reimbursement or checks or whatever the case may be from the other members. We take care of that. So we at Altrua, we alleviate the stress of that off of the member.
Oh, wow.
And
that's
we
pretty
assist
significant
by utilizing.
That's pretty significant. Randall, let me ask you, first of all, how old is the company? And then talk about those health, requirements, if you will, or lifestyle, maybe a better way of putting it, lifestyle requirements that you use to help contain costs.
Yes. Altrua meets the recognition, which when Obamacare came into place, it was December 31st, 1999. Our organization has been in existence since 97. Sharing in families' medical needs continuously as the recognition requires. So as far as the families sharing and everything like that, it requires, healthy living. There's biblical standards in place to, help with the sharing, as Ron was saying, help the escrow account to be protected. One of the things that we do, our statement of standards is, as I said, biblically based, which allows those families to rest assured that we are not covering unhealthy lifestyles.
Okay, and let me double check on those years. What year did you get started?
Our organization started in 1997.
Yeah, so it was long before Obamacare.
Yes, sir.
Yeah, that's very good. Go ahead, Dr. Goyal.
The health sharing ministries, Kevin, it's been catching up. There are over 2 million members across the country now, and it's gained more and more momentum. And Altrua, though, and Ron, this is a question to you, is based out of Austin, I believe. And how are you guys getting providers to work with you guys?
Correct. We are based out of Austin, and we are, for the practitioner side of it, our members and a program are part of the PHCS provider network, which is multi-plan, one of the largest provider networks in the country. Our facilities, our members are allowed to go to whatever that facility might be. That, when it comes to the payment of a need through the facility, or again claims for facility, that's all based off of RVP pricing. And so our program is based off of the practitioner side of it, again, the PHCS multi-plan network. So it's a massive network throughout the U.S. Now, if one of our members chooses to be able to, they say, hey, I want to go to my physician, then what it is that we look at, again, the distance, because although we're based out of Austin, we are nationwide, and so we have members nationwide. So it sometimes it just depends upon where their specific physician is, and it might be something that we look at working with that practitioner, if you will, to bring them in as a provider. But currently, right now, members are practitioners are based out of the PHCS multi-plan network.
Randall, talk about the growth you guys have experienced, particularly since Obamacare became law.
Yes, that's a real exciting thing, the growth that we're currently obtaining.
And talk a little louder, please.
Yes, sir. One thing that we do with our growth is our foundation is real secure for the intake and the enrollment of new members. Member services is really key as well. So we've been building the foundation to handle the large intake of members that's coming in. And so one thing that we've been doing is just getting our systems in place, securing our systems at a level that will be able to handle the large, massive growth that we're obtaining at this time. We do have a couple of groups that we work with also within the Asian community. So we're really trying to target every section of individuals within the United States here.
Yeah, and because of the fact that you are one of the few that don't have a sectarian approach as far as religion goes, and yet there's just tons of groups that are outside of the Christian space, but are committed to similar values. It seems like it's a great opportunity for a company like yours.
Yes, we're more evangelistic. Well, I shouldn't say more evangelistic, but our mindset is real evangelistic. Not having that statement of faith allows us to reach out to those who do not yet know about the Bible.
Right.
But that can live a healthy, clean lifestyle. So our goal is to reach those and then teach them about caring for one another. And as long as they can honor the statement of standards that we have, we look forward to those type of people coming on so we can share the gospel, if you will, through healthcare sharing. Yeah,
thanks a lot, Ron and Randall. Great topic. And the website is Altrua HealthShare.org. That's ALTRUA HealthShare.org. And Dr. Goyal, take about 30 seconds just to wrap up the segment.
Yes, thank you again for all the comments. For our listeners out there, I think this is a great option to look at, because what you are getting now is really good coverage to cover your risk, to cover your healthcare expenses at much lower cost. So you're looking at about $300 on average for a family of, let's say, 4. And the main reason is less administration costs, and the way the healthcare sharing ministry works, it's a very sensible way of providing coverage to people. And I think we are excited to promote this through our clinic, through our media channels, and we look forward to supporting you guys in your endeavors.
Yeah, very good stuff. Thanks so much for lining up this interview, Dr. Goyal, and that's OurWayHealth.com. Thanks to all of you, gentlemen. Great segment, very educational, very important, and keep up the good work.
Thank you very much.
Thank you, Kevin.
You bet. When we come back, more for you. I do want to remind you, best content here shows up over there at USAToReview.com, and you're listening to The Price of Business.